Hello and welcome to today's session. Today we're going to look at equipment. In the previous sessions we've not needed to use much equipment, we've just needed the knowledge. But as we move forward we will need equipment to help us with our treatment. Whenever we approach a casualty, the first thing we think about is danger. So the first piece of kit we're going to think about is our gloves. It's important that we utilise gloves when treating a casualty, especially when blood or body fluids are involved, so we don't get cross-infection, either from us to the casualty or from the casualty back to us. These are nitrile gloves. We used to use latex, but you should try and avoid those now, as so many people are allergic to latex, and the last thing we want to do is give them an allergic reaction. They come in various sizes, from extra small up to extra large. It's important to get the right size for you to make it easy for you to get the gloves on. And it's important to do this before you start treating your casualty. So I've got my gloves on, I can treat my casualty, I can make notes on the back of my hand to remind me what their name is and any key details right at the start. And then when I finish, I need to remove them and dispose of them safely. So if I grab the edge of the glove and I pull it off, I'm not touching the inside of the outside of the glove. I can now scrunch it up in my hand, take the other glove, slide it over the top, and the dirty glove is inside the other glove. That is now safe for me to go and dispose into clinical waste. So that's our gloves. Talking of clinical waste, you can come across the yellow bags. These are for putting any first aid equipment into that has been covered in bodily fluids, and that is to go off and get incinerated. You may not have yellow bags within your kit, but you can use a carrier bag, a sandwich bag. The key thing is you manage any items that get dirty, like your bandages or your dressings, that they get sealed into a bag, and then either hand them over to the ambulance service for them to dispose of safely, or double bag it and then put it into the waste. If we're talking about resuscitation, you would come across a pocket mask. Now in the resuscitation we've done recently, we're dealing with the outbreak of COVID-19 at the moment, so for adults we're not doing mouth to mouth, we're doing compressions only. But if you were to get back involved when COVID's over, then you might utilise a pocket mask. The idea with a pocket mask is it goes over the casualty's face, allowing you to breathe through the mask through a one-way valve, and it protects you from anything coming back from the casualty. You've got the head strap to help it stay on while you're doing compressions. And you'll notice on some that they have a little inlet. You don't need to worry about this. This is for oxygen trained first aiders to administer oxygen while giving mouth to mouth. So that's your pocket mask. Pocket masks are a bit big to carry in your pocket or in your handbag, so you can come across face shields. So this can fit in your wallet or in a key ring. It's very easy to follow as to where you put this on your casualty, and it provides some protection for you while providing mouth to mouth. And you've got the piece of material here to help protect you from any airborne that's coming back from your casualty and minimising the chance of infection. And finally, our hand gel. Best practice when working with a casualty is to wash your hands with soap and water beforehand, and then to wash them again afterwards. And as everything we're talking about with COVID-19 at the moment, it's been, make sure you wash your hands for 20 seconds, make sure they're really clean. You may not be in a situation where you can quickly access water. So your hand gel, this is one to have on a desk. You can get smaller ones that you can hang on your belt or keep in your first aid kit. You can use that before treating your casualty to clean off the bacteria, and after to kill any bacteria. These are not designed for washing your hands. So if your hands are dirty, they're not designed for washing dirt off your hands. They're designed for killing the bacteria. They're also not designed for cleaning your gloves. If you've got to swap between casualty, you swap gloves. So that's your hand gel. So they're the pieces of equipment that we would utilise to keep the casualty and ourselves safe. It might be when you're treating a casualty that you need to access the wound. Their clothing's in the way and they can't easily remove it for you. So this is where your tough cut scissors come in. Bit different to your normal pair of scissors. These, or shears, will cut through clothing. They will also cut through fine wire. So if a clothing's got supportive wires in it, then you'll be able to cut through it. Or if you've got problems with jewellery, you might be able to cut through some items of jewellery that are life-threatening to the casualty. We can then start to think about blood loss. So one of the common dressings that people talk about is an ambulance dressing. The ambulance dressing is made up of a conforming bandage and a pad. So when I unravel, I'll have a short end and then I'll have a pad. Keep your hands away from the pad when unrolling. You don't want to go and get it dirty and infecting it. And that can go over your wound. You've then got plenty of bandage left to bandage that in place. So that's what we know as an ambulance dressing. It's got the conforming bandage and the pad included. Alternatively, you can have a conforming bandage, and the conforming bandage literally has no pad. So this you can use for more variety of injuries than what you can with an ambulance dressing. And you can use it with different size pads along with this bandage. The other option when it comes to bandages is your crepe. Your crepe bandage, which you can see here, comes with some clips to hold it in place. So be careful with them. They've got little teeth that you can use to lock onto the end and keep your bandage in place when you've finished. This provides a lot more support. It's a lot stronger than your conforming bandage. And we utilise these when you're dealing with a sprain or strain to provide support around the muscle or around the joint. However, if you didn't have a conforming bandage, you could utilise your crepe bandage instead. And you can utilise that with different types of dressing. So depending on the size of the wound, you would choose whatever size fits the casualty's wound that they have. With these dressings, you will find that one side might be shiny and the other side is dull. The shiny side is a material to stop it sticking to the wound. So you always put the shiny side onto the wound. A lot of them these days are shiny both sides, so you can't make a mistake when you put it onto the wound. So these dressings, different ones you get, Tefal, Melalin, to name but a few, you could utilise with some micropore and stick it on. So if I've got a blister on my foot from walking, I could put a pad and tape it on. If I've got a bleed and it's a major bleed, then I can use a pad with a conforming bandage to control the bleeding and apply lots of pressure. So they're your different types of dressings and your different types of bandages. The other thing to consider with your tape is you can just use that to cover a blister. If when you open it up you make a fold in it, you can then make sure that you're putting an element on that is not sticky over the blister, so that when you pull it off, you don't go and pull the skin off from the blister. You can also use it for broken fingers and taping fingers together. Always check whether casualty is allergic to anything, but micropore, the idea is it's non-allergenic, but always check. I have had someone react in the past. So that's your micropore. Again, different types of tape on the market, micropore being your common one. We also here have gauze swabs. Now the aim with gauze swabs is for cleaning wounds. So I have a number of plies here so that I can clean a wound by taking a ply, dipping it in water, cleaning the area, throw that away, get my next one, clean from the centre out, that one's dirty, throw away, get another ply, centre out, and that allows me to clean up any wounds before I then go and apply a plaster. So there are your gauze swabs. So they're items that we might use with blood loss. If we're dealing with a burn and we've cooled the burn down, but then we need to keep it safe from infection while we go to hospital, we might use our plastic bag. So if my hand is burnt, I can look to put my hand in the bag, seal it up, and that's going to stop infection getting into my burnt hand while I go to hospital. Alternatively, we could be looking at cling film. So you're pulling off a few turns of your cling film, and you can use that to cover a burn and protect it. Last thing we want to do with burns is go and apply a fluffy dressing that's going to stick and get all the fibres stuck in the burn. So we'd use cling film. If we had a sprain or strain, then we'd look to use an instant ice pack. You can get ice packs you can keep in your freezer, which is great for home. Just make sure you sterilise them after use with hot soapy water. But if you're out and about, an instant pack will be great. You'll find that inside there is a gel or a pad to break, so you need to give it a good crack, and you'll feel it starting to go cold. Never go and apply ice packs directly to the skin. Never get your frozen peas directly on the skin. Always wrap it in something like a cloth, or ideally your triangular bandage. So if you're getting my ice pack, I can be wrapping it up in my triangular bandage, and that's going to ensure that it's not too cold against my casualty skin, and is great then for dealing with the soft tissue injuries like your sprain or strain. So that's your ice pack. And then we've got our triangular bandage. If I had any one item in my triangular first aid kit I'd recommend, it's a triangular bandage. You can use it for so many different things. You can use it for slings, you can use it to make your hats, tying off, or if I haven't got a bandage left or I haven't got any in my kit, I can go and fold to make a broad fold bandage, or I can fold again to make a narrow fold bandage, and now I can use that to deal with the fact that I have a bleeding hand and I'm putting pressure on and controlling a bleed. So there's so many different uses for the triangular bandage that, from my point of view of what's in my kit, I would have quite a few of these so that I can strap a leg injury, I can do slings, I can control a bleed, I can put it into cold water and then hold it on as a cold compress. I can wrap up my ice pack in it. Very versatile. Other things you might find in a kit or someone would have is things like their own personal medication. This is an EpiPen, or in this case a trainer, for dealing with someone who is having an anaphylactic reaction. Medications shouldn't really be in a general first aid kit. They should be stored separately so that someone doesn't come along and think, oh, that's paracetamol, great, I'll take those, when actually it's some other medication and they react to it. If it's your own home personal kit, not quite such an issue, but in general kits, don't put medications in. So there's some of the general bits of first aid equipment that you might come across. So many different uses. I wouldn't, from a point of view of first aid kit, build to meet your own needs. As I say, I'd be starting to initially think lots of triangulars. If I'm going hiking, then thinking about trying to keep my kit as small as possible and what can I use for multiple things. So my triangular my crepe, some tape, some pads. I'm going to be able to use these in different combinations to deal with different injuries, rather than having my ambulance dressing that all I can do with it is deal with a bleed. So adapt it to suit your needs. It's just about making sure you've got everything that you need to deal with what you might come across. But you may not always have a first aid kit. So what items around the home could you use instead? Well, I'm currently in my jacket and t-shirt. If I've injured my arm and I need it in a sling, instant sling. If my jacket was done up, I can then start to bring that around and rest my arm in the jacket, and that is providing support. If someone's wearing a tie, you can turn that into a bandage, you can turn that into a sling. So think about how you could use different items around the home. From a point of view of, we talked about the gloves, children are going to be quite stressed if something's happened to them and you need to entertain them to calm them down. Well, thinking about my glove, I can go tie the bottom off. It needs a bit more air in it, but I can tie the bottom off, I can draw some smiley faces on, and suddenly I have a little toy to entertain with a face on my child and just distract them a bit. So you can improvise. So that's what we're looking at for today's session, is a bit of an overview of some of the equipment. I'd like it if you can have a look around your house. What kit have you got? Is it still in date? How would you use it? Actually, what's in your kitchen cupboard? What's in the freezer, your bag of peas? What's in the cupboard, the jumper, the tie? Have a think of what items you could use to improvise when you don't have a first aid kit. In the next session, we'll be starting to look at how you deal with blood loss. So I look forward to seeing you then.